Now, there are varieties of epidemiological determinants for the blindness, such as age, where 30% of the people usually lose their eyesight before the age of 20 years. Then there are different type of the reasons for occurrence of this blindness, which could be refractive error, trachoma, conjunctivitis, malnutrition, where vitamin A deficiency is very important among the children. Then cataract refractive error, glaucoma, diabetes among the middle-aged people, and among the females, it has been reported to be more common as compared to male, probably because of the malnutrition. Then in the person who are suffering from the malnutrition themselves, they are suffering from the vitamin A deficiency, which again is an important determinant of the occurrence of this blindness. Those who are working in some kind of the factory where chances of getting injury to the cornea or to the eye is there, they are also more likely to suffer from the disease or this blindness. Social class, twice it is more prevalent in the poor class as compared to the higher classes. Then in the social factor, treatment by the quacks, ignorance, poverty, low standard of personal and community hygiene, inadequate health services, these are the social factor which is responsible for causing the blindness. So government has started the national program for the prevention and control of the blindness, where avoidable blindness has been said to be one of the important component for on which we can take the action. And this action is being taken in the following aspects. In number one is initial assessment, second is mode of intervention, third is long-term measures, and then we are going to evaluate this. So in the initial assessment, what we are going to do, we are going to assess the magnitude, geographical distribution of the blindness, and what all are the causes which are responsible for causing the disease in a particular area. Because in different area, again, it is important to note that in different area, different causes are responsible. Then method of intervention, primary prevention in terms of training of the peripheral healthcare workers, provision of essential drugs for the simple common type of the diseases like trachoma. We are going to provide the drugs to the individuals, okay, to the ashas for the distribution, to the AIIMS for the distribution, promotion of the personal hygiene, sanitation, good dietary habits, and safety. In the secondary prevention, where caring of the eye is being taken care of at PHC district hospital with eye department, eye clinic, and mobile clinic. They are being provided treatment for certain common diseases which can lead to the blindness. Then tertiary care, national or regional capitals where medical college or center of excellence is there. There are other retinal surgeries or other complex kind of the surgeries which are available in order to treat the diseases related to eye. Then there are certain special programs for the control of blindness in the country which is existing, such as trachoma control program, school eye health services, vitamin A prophylaxis program, and occupational eye health services. Long-term measures. In the long-term measures, we are trying to improve the quality of life, modifying factors such as poor sanitation, lack of adequate water supply, safe water supply, then little intake of the vitamin A rich food, lack of personal hygiene. These all are coming under the long-term measures by which we can avoid the blindness. Now, as I told you that most of the NCDs are having certain common type of the risk factor, and that's why management of the NCD is also more or less similar, or whatever the advice which we are going to offer for one kind of the disease in the NCD group stands same as that of the second or other type of disease among the NCD. So how we are going to manage the NCD? We are going to manage it either by the treatment where we can give the drugs, means medical treatment, or we can perform certain surgeries such as in the coronary heart disease, we are going to conduct the bypass. So surgical intervention can be taken place. While in the prevention, it is the prevention of the, all different type of the NCDs could be done by the prevention of smoking, physical inactivity, prevention of the poor nutrition, prevention of the harmful use of the alcohol, and then we are going to advise certain health promotion activities such as healthy diet, physical activity or yoga or meditation. So let us see, what all are the important things under this. Mainly the NCD can be controlled by physical activity along with that of the healthy nutritious diet. Okay, so these all comes under the health promotion activities. All type of NCD patient who are visiting to us, we used to advise for these two components, that is related with the physical activity and related with that of the healthy diet. So in the healthy diet, what we used to advise, we used to say that start, although they are suffering, but we used to advise them that they can prevent these type of NCDs to their generation among their kids. So early intervention should start in their childhood, because what happens once you have offered to your child the Maggie or fast food or any other junk food, it will come into their behavior. Now, if he is going to consume for certain duration of time, then he is not being able, or it become very difficult for him or her to avoid from that food, because it becomes his personality. So that's why early intervention should start in the childhood. We should advise our child, we should offer our child good food, healthy food. Cereal should be offered, fruit should be offered, vegetable should be offered. An initial goal of a 5 to 10% reduction in the weight is reasonable. And if we are able to achieve this, it means that we are going in right direction. A weight reduction rate of 1 to 2 pounds, means 500 gram approximately to 1 kgs weekly, is achievable if we are going to restrict ourselves in terms of calorie to 500 to 1000 kilocalorie. Caloric restriction alone is not effective, as I mentioned earlier also. If we are just going to, control the NCD by the calorie intake, we are not going to succeed. We have to also combine it with the physical activity. That also has been practically, I have seen among the patient, and it has come under the, this result has been presented under different research studies as well. A low energy dense diet composed of generous quantities of vegetable and fruits promotes health and facilitates the weight management. Recommended level of the physical activity for children 5 to 17 years. In the physical activity, what we used to advise? We used to advise that games which are creating aerobic exercises, which are producing vigorous kind of the physical activity among the children. So among 5 to 17 years of age group child, we used to advise that at least minimum, you can go far beyond the 60 minutes, but at least 60 minutes of moderate to physical and vigorous intensity physical activity should be done daily. Greater than 60 minutes are having certain additional benefits, of course. And most of the daily physical activity should be aerobic, means vigorous exercise. So vigorous intensity activities and muscle and bone strengthening physical activities should be conducted at least 3 times per week. And people used to ask, again, this is a practical example which we used to offer, or which we used to advise to our patients. They used to ask us, sir, what type of activity we should do. So all those activities, this, in the bracket, these are the minutes which have been mentioned. So these minutes is equivalent to burn 150 kilocalorie. And WHO says that we should perform at least 150 minutes of activities in a week to keep ourselves physically active, to keep ourselves away from the non-communicable disease. So these all different type of the common course which has been mentioned here, such as washing and waxing car, which requires 45 to 60 minutes. So these all are different. You can take a snap, or I will share the presentation as well. Wheeling self in the wheelchair require 30 to 40 minutes. Then pushing a stroller. So these all in the bracket, the figures mention the total number of minutes which is required to consume 150 kilocalorie. And here, these all are the less vigorous activities. These gardening, wheeling self, these all are moderate variety of the activities. And more vigorous activities are these, that is basketball, jumping rows, running for 1.5 miles within 15 minutes. Further, this is again very important slide. We used to offer in terms of this one, 0, 5, 10, 30, 150.